Dr. Bill Adams here, and this is No Spin Live special edition where you're going to learn about hot topics from the world's top plastic surgeons. Let's get down to it. First story. So this is a supposed new trend that people are wanting to fix their belly buttons. Their belly buttons are offline and they don't like their belly buttons, so umbilicoplasty. You seen this in your practice, or you think this is some new, false, kind of crazy story?
I don't think it's false. Let me kind of break it down real quick for the rest of my colleagues so they can kind of take a meal out of this. If the belly button is not in the midline, it's usually because of twin birth or eccentricity abdominal stretching. I've seen this a lot in abdominoplasty where the fetus was stretching one side more, so you get the belly button pushed over to one side. Now that's pre-op belly button off the midline. Then there's the old post-op belly button off the midline, right? The iatrogenic that the surgeon did it. But more importantly is the fact that the belly button should never be flush with the abdominal skin. And so often we see it in our tummy tucks that. And I think the real art of umbilicoplasty and an abdominoplasty is obviously to keep it midline, but also to get it down in a three-dimensional way, just like Hoyos in Colombia has done such a great job. And I think that a well-placed umbilicus that's got three-dimensionality, that's off-center, is okay. It's way better than a perfectly symmetric umbilicus that is flush with the skin.
One thing we know is human beings are naturally asymmetric, so no one really truly has a real midline umbilicus. And we know that. There was studies that have proven that the belly button is never exactly in the middle. What I have seen, because I have had patients request this, is patients who maybe had piercings when they were younger, then they had children, and the umbilicus or the belly button stretches, it kind of doesn't look as nice. I have found that it's really hard to fix those belly buttons. I've tried it, I've done a ton of different procedures, and nothing ever works that great, so I'm a little reluctant to do these.
Well, I agree. These can be tough procedures, and most belly buttons are okay after surgery or after childbearing, but occasionally you do get extremes where there may be a small umbilical hernia. We are seeing this more and more with laparoscopic procedures that are done through the umbilicus, where they're iatrogenic or things that are created by surgeons that we are able to fix.
I think this is really about evaluating the deformity, talking with the patient, understanding what their complaint is and whether or not you feel comfortable and confident enough to fix it. There are times when someone comes in, they have a minor issue with their belly button. It's a relatively simple solution, and you feel comfortable that the outcome is going to be predictable and you can make this person happy. On the other hand, you can fall into scenarios where the enemy of good is perfect, in which case you want to avoid that type of operation and communicate with the patient and say, look, I really don't think this is going to be that much better, and you should live with this and accept this belly button as being good, but maybe not perfect.
Bruce?
Well, outside of what John said about the piercing and all, I'm just not having people coming in specifically focusing, which I think was the point of this story, focusing on their belly button and not the rest of their abdomen. Typically, post-pregnancy, that whole abdominal wall is in trouble. There's a diastasis, and all those things need addressed, and the belly button is just part of it. But the concept of people coming in just for the belly button, I'm not seeing it really. So maybe this is something that is catching on. Maybe we'll start to see more.
Pat, what do you think?
I think there's two things here. I do see some very thin women who come in and think they need abdominoplasty. That's what they'll make the appointment for. And then when you see them, what they don't like is some loose skin, a few little stretch marks. It's right above their belly button. And their patients that don't have any fat, and they have to realize that if you're going to take that extra skin off above their belly button, they're going to trade a scar. And is that a worthwhile trade? I think the other thing is if somebody's noticing that their belly button's a millimeter or two offline, you're asking for trouble if you're going to operate on them, because the chances of you being able to fix that as an isolated procedure are slim and none.
I have to agree with Bruce. In my practice, I'm not seeing people who are coming for isolated umbilicoplasty. They're usually coming because they have excess skin and a rectus diastasis where they would need an abdominoplasty. And in those patients, they do ask about how the umbilicus will be. And you try to adhere to what Dan had referred to in creating a 3D structure, trying to keep it midline and looking natural.
You had the final word, Steve.
Yeah, I mean, there's been some great comments. For me, it's very simple. Does the patient need an abdominoplasty or tummy tuck or not? And so there's some minor things, maybe an old piercing where some loose or folded over skin can be excised and the trade-off for that new scar is better and acceptable to the patient. But sometimes when a patient says they're focused on their belly button and they're starting to talk about a bunch of different things, we have to be really careful that they don't think they're going to get the correction they want with just an umbilical procedure. Maybe they want a tummy tuck, they're just not using the right words. So we got to clue in to what the patient's emotions are, what the kind of psychiatry of that discussion is at the time, and just be aware of that. So an isolated umbilicoplasty, just a little thing for a belly button, probably not best for most patients. I think that's my takeaway.
All right, well, that's some great stuff. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.